Hi, welcome back. Thanks for being with us. I'm Lisa Lang from Rethink, Winnebago's Healthy Living Partnership from the Winnebago County Health Department. And I am joined here with Chris Wardlow. Hi, Chris.
Hi, Lisa.
Hi there. And he is from ThedaCare Behavioral Health, and he is a prevention specialist. And we are so lucky to consider him a friend and partner of Rethink. So thanks. Our first segment today, we looked a little bit at some of the social norms. Most don't do it, and we're excited for that number and the statistics. But when we look at the balance of most don't, some do, what is the thing that everyone wishes they could tell their kid? What is that one thing, that causation indicator, if you will, that would get kids to stay away from it?
Well, I think, unfortunately there isn't one sort of silver bullet, one ideal message out there. When we talk about kids choosing not to use, like most kids are, there are a lot of factors that come into play, and those factors exist not only in them as individuals, but in families, in their schools, amongst their peer groups, and also in the community. So there are a lot of factors that come into play that both influence a young person not to use, but also kids that are vulnerable influence them to make that choice to use. And fortunately, I wish there was one silver bullet, and if there was one, you and I would be unemployed and doing something else for a living, but there's not. It's a little more complicated than that.
It sounds like a real combination of those four areas. So family, school, environment, and
peers.
And your peers, which is huge, and I think probably maybe one of the biggest ones depending on which age group. But let's talk more about those specifically when it comes to risk factors.
Okay.
When you're talking about peer perceptions, in that all the kids and the friends around that individual student, what would be some things that would make it more risky?
Well, especially if those kids are using themselves. So if I'm a young person in high school and I'm associating with a group of people that are using, okay, that increases my risk. Secondly, if my perception is that my friends really could care less either way, that would increase my risk as well. So peers play a huge role. It's interesting. Younger teens, middle school, early middle school, up until 7th, 8th grade, parents still play a huge factor in influencing young people's thoughts and perceptions. And that begins to change a little bit in high school. And we see that in 8th grade, 9th grade, but then into high school where peers begin to play a bigger factor. Doesn't mean that parents still aren't a huge protective factor for their young people, but really kids begin to model more of their behaviors and seek out acceptance from their peers as they move into later adolescence.
Sure. Wow, that's really important. And what can schools do to be in that category of helping? How could schools be viewed as risk factors? What's going on at schools?
Well, I think fortunately, and you know this, in the schools, the districts that you work with, the districts that I work with, all of our schools are really doing something here when it comes to prevention. And they're doing what they can with the resources that they have. Unfortunately, school-based prevention programs have experienced a huge cut in funding, so it's harder. It's harder for them to do the things they used to do. But one of the biggest factors that we know in the research, and it's pretty impressive research done by Dr. Blum, it looks at school connectedness. And kids that feel connected to school, feel a bond to school, feel like their peers at school care about who they are as people and students, and feel that teachers and the adults at school care about who they are as people, those kids are far less likely to engage in these risky behaviors. So it's becoming harder and harder to do those prevention programs that we know work because of lack of funding. But one thing schools can continue to do, and a lot of our schools are working hard at this, is really making sure every young person feels connected. And that can be, it doesn't have to be teachers either. Teachers obviously, have greater face time with these young people, but it can be secretaries, it can be janitors, it can be police school aides, coaches, absolutely. So the important thing is every kid is connected to at least one adult in a positive way at that school.
Right, and the schools that I've been in lately do such an awesome job. Outside of the organized sports or extracurricular things, it's also just the contact. I see the teachers in the hallway and they're talking to kids and, hey, you got a new haircut, or how's your mom doing? And they're in there talking to them. And I mean, I go to a lot of schools. I'm so impressed.
Right.
You know, every last one. I'm so impressed by them, public or private, that school connectedness, no matter what the kid looks like or what his last name is, they're out there talking to him. And that goes a long way.
Well, and I think it's reflected in the statistics that you're using for your social norms campaign. I mean, we've got to give credit where credit is due, and our schools have been doing an awesome job with prevention. And so it's because of them that a lot of our numbers look as good as they do. Now, we still got this gap. You know, we've still got a lot of kids that concern us. And, you know, we've got to hone in and focus in on those kids and figure out, you know, how we can boost protective factors in their lives.
Sure.
But, you know, so our job isn't even close to being done, as you know. But, you know, I think we can be proud of the fact that the majority of our young people are making the choice, making decisions to not use and to be healthy.
Sure. Let's talk about the family risk factors. What could some of those be?
Well, role modeling is huge. Okay.
And this is always a difficult one to talk about. You know, especially with alcohol, because at 21 it's legal. And so,
well, and we live in Wisconsin, and you know, we have a lot of pride in our tradition. And so it does become pretty tough, but you know, the research is becoming stronger and stronger that role modeling is huge. So it's okay, you know, for mom and dad to drink, and drink responsibly, drink in moderation. That's, you know, that's all right, but it becomes more of an issue when everything we do as a family has to involve alcohol. That alcohol becomes the centerpiece of all of our celebrations, of all of our holidays, all of our festivities. Then that becomes a risk factor. Mom and dad drinking responsibly, drinking in moderation at healthy levels, that's all right. That's fine. There's no risk in that. The risk becomes when, as a young person, we see our family consuming alcohol at you know, every event
or to cope too, for stress.
Well, exactly. Yeah, absolutely. If that's the way I deal with you know, a boss that I don't like, or with stress at work, or with what maybe a depression, then kids learn that. Kids learn that, okay, this is how we do this.
Right.
Yeah.
So families need to watch that. And then the last thing that you mentioned I wanted to highlight was the environment or community factors. Of course, I know some of that, but it might be new to others when they're talking about, you know, what is in our community. I'm not even aware of what you're talking about. Yeah,
and I think, again, this kind of goes back to that sort of sensitivity about being, growing up, living in Wisconsin, being a tremendous place to live and raise kids. But in all honesty, we bombard our young people with alcohol messages. You can't go far. I would venture to guess you could probably go outside the door here at the station and look around and see at least one beer ad just in your sight line. So, you know, kids see that, and kids pick up on that. And not only that, but at our festivals, where alcohol plays a big role in our festivals, and that's fine. But again, when the perception is that our entire festival is built around the consumption of alcohol, you know, and that may not be intentional, and I'm sure it's not by event organizers, but when that's the perception, kids again are reinforced, well, if we're going to have fun, we drink.
Right. And that's one of the things that Rethink is striving to improve on, is kind of asking people to rethink, reassess. Let's look at some data. Let's see, are we really getting out of this what we want out of it? And something that I've been sensitive to is placement, product placement, you know, or festival booth placement. You know, I'm at a gas station and I see these flasks, the alcohol flasks. Might be fine, might be for people going somewhere to drink legally, but they're all right by the teddy bears and the candy. You know, in the beer tent at a festival, should it be right by the cotton candy and the lemonade stand, things that are typically for youth? So some of those environmental factors we have to be aware of when I'm sending my son in to get Gatorade and a bag of Fritos. he's got to walk past the beer cave and everything with that. So things are just different than when we were kids. People will say that sometimes, and the truth is the accessibility is different with the onset of the internet, and then also the drugs are different. Can you talk just briefly, we have a few minutes left, but talk briefly about what you know about some of those changes.
Well, you know, we're blessed as a society to have more and more prescription drugs to treat our ailments and our illnesses. But the downside to that is that, you know, we've got this huge influx of prescription drugs, and kids have figured out, using the internet and other resources, you know, that these drugs might have some recreational value to them. And so we've got a whole new realm of drugs we're dealing with, and we're dealing with these genius chemists that are creating these new legal substances and marketing them to kids as basic household products, you know. So it's a different world.
Right. Well, in summary then, we want to make sure some things that our viewers know is, if you want to, which we all do, increase the protective factors, give some thought to family, monitoring your kids.
Talk to your kids, monitor your kids. Yep.
And be talking to them about things in the community, getting them involved with some things at school, talking to them about favorite teachers or what have you, following up on grades, and also setting those guidelines and holding them accountable, holding them responsible for those. I want to thank you for being here today.
You bet.
And I want to thank both of our guests for being here today, as well as Oshkosh Area School District. And to summarize, I would like to say, if you would like to, either as a corporate sponsor or an individual donor, get more involved to help some of the Social Norms campaign reach more than we are currently, we would be accepting donations. And you can contact us at Rethink. Again, my name is Lisa Lang. And I would like to remind you in closing that you can always rethink, and thank you for joining. Please check out our website at rethinkwinnebago.org or contact us at 232-3000, and thank you for watching today.